Hi, my name is Rabi Talk. I'm one of the cerebrovascular specialists. I do open cerebrovascular and endovascular, and I work at Mayo Clinic in Florida. Stroke in general as an event is an acute attack to the brain, and it can be split into two classes. One of them is ischemic, which means there is lack of blood flow to the brain. Hemorrhagic is the other side, which is when they're bleeding into the brain and damage is caused by a bleeding. In general, most people understand it as ischemic stroke, and they don't talk about the hemorrhagic, but it's part of the stroke. As you know, stroke is a devastating disease to many of our families, and it's basically a bad disease when it happens. So our goal most of the time, what we like to treat for stroke, is how to prevent it from happening. And when we talk about prevention, we can talk about primary prevention, secondary prevention, and tertiary prevention. Primary prevention is when you prevent things from happening even before they occur. Secondary and tertiary is you manage the damage or you prevent things from happening again. And our goal is ideally to manage it before it happens. However, so in terms of primary prevention, we have the modalities to prevent it from happening. If it happens, we're very interested to see patients as soon as possible, and we have all the therapeutic modalities for rescuing in terms of opening a vessel that's acutely blocked, maintaining it open, and even further treatment. In stroke, with the way we like people to think about it, is time is brain. Whenever a stroke happens, it's the earliest, the fastest, and the closest hospital, basically. We're trying to build a network of hospitals so people can get local attentions next to their home, but that hospital is hubbed to a main tertiary care facility such as Mayo Clinic in Florida, and once the patient gets to the emergency room in the peripheral hospital, we get connected and involved in their care. So if there is a treatment that should be initiated, it will be started at that time. And if the patient needs advanced level of care, we will guide them what needs to be done, and we will be ready for them. So we'll shortcut every loop, and we'll get them to what they need in the shortest time.